Good morning. Today we'll be talking about perimenopause and menopause in line with our theme about talking about women's issues this month, which is the month that has the International Women's Day. Thank you, Dr. Kay and Dr. Simi, for coming on the program with us. We appreciate your being here.
You're welcome.
You're very welcome.
Thank you. So, Dr. Kay, if I can start with you. Can you tell us technically what exactly is menopause and what brings it about in women?
So menopause is it's a very dynamic process in the life of a woman. It marks a natural or biological process that tells the woman that your fertility or your menstrual process, your menstrual cycle has come to an end. So this is when, technically, as a means of definition, when a woman has not had her menstrual cycles, her menstrual periods, for a duration of 12 consecutive months. So we can say it's a definition of retrospect. So a woman is enjoying herself, she's having irregular periods, and then she looks back and then she can see that in the last 12 months, I've not had my periods. Now, it doesn't just, the hallmark of it is not just absence of period, really. There are a lot of symptoms and signs that do come with it. So technically, that's what menopause is. And
Okay.
yeah, answering the second part of your question, what brings about menopause, really? So menopause is regulated by a number of body mechanisms, and this happens from the brain to the genital organs of the lady, classically the ovaries. And then that is when the signals that tell the ovaries to produce these chemicals that regularize a woman's reproductive life, that's when the signals stop. So all those hormones are going through a significant shutdown in that lady. Yeah.
Okay. And so, Simi, or, from your perspective as a GP, he's given us the technical sort of details as a gynecologist. You say you're the one who often sees, as in the GPs, often see the first cases or the first symptoms when a woman comes in complaining. So what are the kind of symptoms that a woman has when she has menopause? What are the kind of issues that she can present with to the GP's clinic?
Yes, thank you, Dr. Pamela. I mean, I think this is our bread and butter in primary care land. As GPs, we look after women in perimenopause and menopause and postmenopausally. And usually, I think the commonest symptoms for me practicing in the UK for 22 years, the commonest symptoms a woman will come with is, my mood. Funny enough, even though you talk about hot flushes, usually they come and say, I'm not feeling quite myself, my mood is not great. I'm getting quite forgetful. I'm not able to lose weight. Just general issues. I'm not feeling productive. I'm feeling very, very irritable. Nobody wants to be around me. My partner is complaining. My children are complaining. They all avoid me. It's things that actually impact their interpersonal relationships is usually what drives them to the GP. That's the commonest. And then hot flushes, even though they're common, women tend to just go along with it. It's the interpersonal, the ones that affect their relationship with their family or their friends or their work that usually drives them to look for a solution with a GP.
Okay, so Dr. K, can you describe what are the different stages of menopause, the perimenopause, menopause, postmenopause, and how do they affect women differently?
Thank you very much. So these different entities all present in different ways. Perimenopause, typically I'd like to describe it as a transition period. And I like to use this analogy when I talk to a lot of these women. So the child is about to start school, and then the school tells you, bring the child over a 3-week period for, what we call the settling in phase. So a school that's supposed to run for, let's say, 8 hours a day, the school, they start to expose the child for, let's say, 3 hours a day. So that transition period. So this woman suddenly observes that, my periods are irregular. Typically, it happens between the ages of 40 to 45, before 45. Because anything before 40, there's a different term for that. So perimenopause can last up to 4 to 8 years in many women, but typically it starts from the age of 40. So this is when periods become highly irregular. And then the symptoms of menopause, like Dr. Simi did mention, hot flushes, mood swings, anxiety, depression, sleep disorders, they begin to show up. Her periods don't typically stop for 12 consecutive months, but they become highly irregular. Menopause itself, it's like telling the child, today you are starting school. So it is when you give the woman that diagnosis that we've looked back, you've got these symptoms. In the last 12 consecutive months, you've not had your periods. So that is a one-time event. Menopause, this is what you now have. You're now menopausal. Okay, post-menopause is something that she's going to deal with. Is the rest of the life. So the child stays in the school throughout that term. So post-menopause is from when a woman is menopausal to everything that happens after then. Menopause itself has a lot to, it comes with a lot of these very depressing or very disturbing symptoms. So all the symptoms we did mention, menstrual irregularities, and then all the vasomotor symptoms, like we will call them, is what happens then. And then we start to plan. And then postmenopause is when, we look after the woman. It can last, it lasts from menopause up to the end of her life, really. And then that's when we start to use a lot of strategies to try to curtail all the symptoms that she's feeling. So, as a means of just summarizing, perimenopause, transition period between the age of 40 before 45, it can last up to 4 to 8 years. Menopause is when you make the diagnosis. Postmenopause is a period after that till the end of her life.
Okay. No, that's important to note. And can you tell me, how does menopause affect bone health, heart health, and metabolism?
Thank you, Dr. Pamela. This is a very important question because what I've observed, like Dr. Simi did mention, is that many people come with, when they present in the GPs, when they present in primary care, they come with these mood changes. They come with some of these, vasomotor symptoms. But what many people don't know is that menopause and postmenopause as a standalone entity has other things with it. You've mentioned bone health. You've mentioned heart risk. You've mentioned metabolism. I did mention earlier that one of the hormones, I like to call them chemicals just for easy understanding, is that drives this. There are three primary hormones that drive all these processes. And there are hormones that are found in a woman and a man. Although in women, you could find them in greater quantities compared to a man. So estrogen, progesterone are the main female hormones that are found in a lady. And then in a man, you've got testosterone that men have got more than women. But a lady can also have testosterone. So there is a significant drop at this point in time in the level of estrogen, in the level of progesterone, in the level of testosterone. Estrogen is very important because it helps our blood vessels to be very flexible. So it protects the heart. It has that protective effect on the heart. When we're talking about the bone, it explaining it has to do with bone formation and bone destruction, if I can use that term. So we form bones. After a while those bones they go and then new ones are formed, and estrogen plays a very important role in that. It also plays a very important role in what we call collagen formation. Collagen formation is very important for muscles, bone health, and all that. Really important. Metabolism, in terms of metabolism, distribution of fat in the body is really important. So what happens is that when there's a drop in estrogen, that distribution of fat is affected. So you find the lady having more fat in her tummy, belly fat. And we know that belly fat is more dangerous compared to fat in other parts of the body, not notably the heart, but belly fat is not something we want in a woman. So that is really important. So it affects the bone by this. It affects the heart by the absence of that protective effect on the blood vessels of the heart. And for metabolism, it affects it in a way that redistribution of fat is impaired. Thank you.
Okay, so thank you. So Dr. Simi, if I can just start with something very interesting. We talked about symptoms. We spoke about symptoms earlier. But how does the menopause symptoms differ from what you might call normal aging symptoms? Because people say, okay, these are normal aging symptoms. How does it differ? from the menopause symptoms? How do you distinguish it in your patient?
Yeah, I mean, there are linkages, but they are starkly different because with menopause or perimenopause, the symptoms are linked to the deficiency or the reduction in the female hormones that are predominant, which is estrogen, progesterone, testosterone, and a sharp rise in the stimulating hormones like FSH and LH. As opposed to aging, where you have degeneration of the joints. You know, you might have just a bit of arthritis, which is part of aging, although a reduction in estrogen will accelerate that as well. So if somebody who is having natural aging, which is almost now impossible with women because you're going to go through menopause whether you like it or not, will normally complain of, oh, my back hurts, my leg hurts, or, you know, my joints are painful. But with the hormonal profile, with the hormonal symptoms, you would know as a doctor that actually there's an influence of this. There are other symptoms that might not be as clear cut, something like depression, because somebody may have already had depression from when they were young, and trying to actually separate and say, is this worsened by the menopause? Like a patient I'm dealing with at the moment with really terrible depression, and I'm trying to decide whether this is post-menopausal symptom, you know, of the mood changes, or whether this is something from her background. But it just comes down to the science of it, you know, really thinking about it, asking questions, taking a really good history. The blood tests are not that relevant, to be honest, when it comes to women who are in menopause. We know what we're going to find usually, but if you're going to give HRT, then it may be useful at that point.
Thank you very much. If I can ask you, Dr. Simi, how can women manage this roller coaster that often comes with menopause?
Right. Thank you for that question. I think mood disturbances are quite common during this phase, perimenopause and menopause phase. And usually many women have never had this situation before. So whether you've had it before or you haven't had it before, the most important thing is to go and see a doctor and really explain yourself and advocate for yourself. Like what I always say is advocate for yourself. If this is not usual for you, speak up. There's nothing embarrassing about mental health or mood disorders, and find a doctor that can help you and point in the right direction. For instance, with mood disturbances, exercise is really helpful. So you don't necessarily need HRT. So things like exercise, cognitive behavioral therapy, journaling, you know, the simple things, vitamin D can really help your mood as well. So look at the simple things first, and then find yourself a doctor, explain to them, and then you can explore all the different alternatives together and have a shared plan, I'll say, is the way to deal with it. But these are quite serious
They're actually
symptoms.
very, very serious. And if I may just take it up, because
yeah.
often the family is affected, the husband is affected. And in Nigeria, unfortunately, a lot of men don't know about menopause. They don't understand what has happened, what has come over their wife. And I don't know what you think about how we can deal with this. You know, how do we get our men to understand more? Because, you know, just before you were talking about the lack of knowledge about menopause in the system, perhaps you could start off, Dr. Simi, and then Dr. K, you can just chime in as to, you know, your perspective, particularly as a man.
Yeah, absolutely. As you said, very serious, because we know many women actually get so low during this period, and we know that there's a spike in women harming themselves in this age period. And there's a lack of understanding from the whole family and partners as well. I think it's really important that everyone educates themselves. So the woman going through it may not be the best person to educate her partner, but it's by asking questions, by the husband, what's going on, how can I support you? And then men out there also educating each other, because many men are probably going through the same experience, living with their wives around the same age. So it's worth them talking to each other and finding out how they can help their wives and support their wives out.
I think I totally agree with you. We have to look at the background in the home. What's happening? What's been happening before this? Menopause is one of the things that when it just happens bang on, it's like, well, let's look at the other extreme. When a young girl, 11, 12, 13, begins to see her period, for many people, it's a shock. And then they're just wondering what's happening. They become confused and everything. So to help increase support for this woman from her partner or her husband, he needs to understand that we need to look at what's been happening, the sort of communication they have. If ab initio, they're already having a communication problem, on mega things, mere things, then it's going to be really difficult. So it's easier to deal with this in a home where there's already a background for open communication. One of the things we've tried to advise is organization, job places, putting out patient info, not patient now, information flyers, and then just letting people know that there's something like this. So the man goes to work, he works in the bank, he goes to work, and then that day he finishes work, and then there's a flyer, there's a leaflet that talks about menopause, and it has that very captivating capture. Do you know why your wife's period has stopped? That sort of a thing. So it's a two-way thing. Communication in that home before then, and then the kind of information that man is exposed to, even outside the home. So when the communication is better, then she can easily open up. I've got this. And if he has that information before then it's easier to relate with what's happening, really.
Now, in fact, if you recall, we also had somebody who was questioning and saying, is this all right now for the men to go out and have side chicks? So there's often confusion, often issues. Then there's some sexual issues, and the man goes outside. I mean, I'm asking you, Dr. K, as a man, really, is this acceptable?
As a standalone reason, of course, it's not something we will advise. We are not pro that. That's the truth. Because this is not the woman's fault. Her body is going through a transition program. It's a transition process. She's going through a lot. She has nothing in her own power to control this. When it comes to sexual, relativity and, actions and processes, there's a lot to understand. It's really important because she goes through a lot of processes, from dryness down below to irritation, soreness, pain when she's meeting her partner. It's a lot. And then this is happening, and the man is wondering, you were never like this. So there are a number of things and strategies. It's a spectrum. We do this, it helps, or it fails, then we go to the next step. There are a number of things that can happen. But like I did say earlier, communication is very important. So if those symptoms have started coming up, then she needs to open up. I've been going through this, or he needs to probe further. This was not, this one of the things. Let me mention this here, that one of the things that happen very classically in postmenopausal women is that the time it takes for arousal sharply increases. So if it took 5 minutes for arousal, previously it could take up to 15 to 20 minutes in this time. So there's a lot of change. There's a significant change, and then the man is wondering. It's if I would say bang on, it's not a reason. It's not a reason. As a stand, it's not a reason, but it's just understanding why this happens and then seeking support. Don't keep quiet. Seek support. There are too many strategies to help with that.
Dr. Simi, it's very interesting that there's some people say that they write about it, the sex improves for women, some postmenopausal women. How come it improves for some and it doesn't improve for others? And what can women do about it?
I mean, I'm not sure about the experience of those it improves for, because with the estrogen decline, then you have atrophy in the vagina, makes it sore, makes you uncomfortable. But some people maybe have very supportive partners that they can use lubricants over the counter. They have a very, as Dr. K said, a very open, communicative, trusting relationship, and they can work through it together. So it improves that way because of the intimacy, as opposed to other couples where maybe they're not as open. So maybe that's why it improves for them. And then for others who have then dabbled into vaginal estrogens or hormonal replacement therapy, then obviously that would really improve. And I even have patients who have had testosterone as well, which skyrockets their sexual performance and their libido, and they're very, very happy. So it just depends on what everybody is exploring. And I think maybe what we are looking for is more openness, even amongst women as well, and talking about what each person is doing and how you're, improving your own sex life and sharing that with your friends.
No, that's so important. And something else that Dr. K spoke about was menopause in the workplace. How does a woman deal with menopause in the workplace? Because often these symptoms do cascade into affecting her work.
Oh, it does a lot, and it's so significant, and that's why we've tried to push about individualism in the workplace and understanding what works for one and what doesn't work for another person. So what it does is, because this woman has started going through a process, a lot is happening, there are mood swings, she's forgetful, there is that brain fog. Okay, she comes, and then her colleagues that is called Ahmed, she calls him Daniel. So it affects a lot. She's calling in sick more often than she would previously. She's going through hot flushes. She's forgetting. It's affecting her work significantly. But what I think the emphasis we need to place on is not her, but in the kind of support she receives from that work. But the thing is that because menopause is something many people have not come to accept as a transition, they think it's something to fear. They don't even mention it. So if you don't tell your employer, he wouldn't know or she wouldn't know. But if you open
But it's difficult to employ. It is difficult to mention it to the employer. Now, I know. Look, in fact, just as we get to this very exciting part, we have just a couple of minutes left to the program. So, if you can just, while you're talking about this, just use it to wrap up, and just explain how a woman can seek support and get support from her workplace.
Very importantly, the first thing is for her to accept that this is a transition process. So openness. She needs, if she can, she should speak to someone. From the workplace point of view, we need to understand that we could tweak working conditions for some of these women. Okay, so flexible working hours is an option. Flexible working hours, we could explore the option of working remotely. So if she works 5 days in a week, she needs to come. So 2 days she comes on site, the other 3 days she can work, remotely or hybrid. These are some of the things. We could make arrangements for shorter breaks. Okay, a woman that is going through hot flushes, she's going through a lot of things. She could take, shorter breaks, take hydration breaks and all that. The workplace has a lot to do. It's more from the workplace angle than from the woman's angle, because things need to be tweaked. Okay, it affects her mentally. Things need to be tweaked to suit her particular needs. Yeah.
Okay, so Dr. Simi, last words for our listeners. Can you talk about breaking the stigma and empowering women, and also talk about the book that you've recently written to help with this?
Okay, I'll quickly just go through the workplace very quickly. One workplace in Nigeria, there are many workplaces that support women, and I want people to know that there are workplaces that support women in Nigeria, and for others to emulate them. Because I prescribed some HRT for a woman, and her workplace got it for her. She was a very senior lady in her workplace, and she was very well supported. So all other workplaces, please just follow their example. They've done really well. It's nothing to be, it's a big life change, but it's one to embrace because it's ushering you into even better years of beauty, of wisdom, of happiness, and of joy. So just embrace that. I wrote the menopause manual for the Nigerian woman because of what I felt were unique experiences of Nigerian women. And it's just there for information. So feel free to download it on Seller or Amazon, but it's there for information. And I just want women to advocate for themselves. What's been coming up for me is ask, don't just accept it as a life change, or no more sex, no more children, no more of this. No, that's when you should be having the best time of your life. And there are things out there to help you do that. So you don't go into a corner anywhere. Come out, blossom, be the queen that you are, and get that help that you need to transition through that phase and just have a great life is what I would say.
Thank you. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.